research methodology or research. This is called clinical research. Now, the objective of this research is to find out. If you have any problem, please ask me. I will repeat always. Okay. To find out the new facts or to verify the old facts. Simply, this is the two words. Research. Re means again and again. Search means questing or to finding. So, number of times you are trying to find out, is there anything new that is existing, or there is no new one, but yes, we have to verify the old one. Say for example, an incident happens 10 years back or something is going on the last 10 years. Is there any change that is being taken place? Though we know that change is continuous. Is it? Change is continuous. Change is inevitable in our community or in our society. Among the human being also, change is continuous. Before 30 years or 40 years, what we see. Nowadays, we are not seeing these things. Everything is being changed, either automatically or planfully. So, there are two types of change. One is automatic change and there is planned change. Now, the objective of the research is to help the people in planned change. We have to bring about the change in a planned way. Then only it will be successful. For that reasons, we have to undertake different types of research. Specifically, in your field, in the medical field, clinical research or medical research, among the community people, among the patients. Fine. Say for example, before 15 years, people did not have any idea or that much idea about the risk factors of diabetes mellitus. Nowadays, if you collect informations from the community peoples about their knowledge or feelings or practice about the prevention of diabetes, they have already been changed. But the question is that how much change has been taken place, whether the change is at par as you want, whether the change is desirable as you desire, as we desire, as a medical professionals, as a profession of community medicines. What things we want? We want that almost all people can be able to state or can be able to tell about the risk factors of diabetes. Then only it will be easy for the people to prevent diabetes as well as to control diabetes. Clear? How we can know? We have to go to the community. We have to approach the community. We have to collect information from the community by observing them, by interviewing them, by collecting information from them. Then we have to analyze it, compile it, whatever may be. Now the question comes, where to go, how to go, whom to approach, what methods you will adopt, how you will select your interviewee or the respondents, or how you can select the persons to whom you can interview. So this is research, nothing but. Here. Now, in the common sense, research methodology is the study of research methods. What is a method? Method is a structural procedure for bringing about a certain goals like acquiring knowledge or verifying knowledge. This usually involves certain steps like choosing a sample. Perhaps you have an idea about the sample? No. Sample means cross section of the population. Say for example, you are here 4, 5, 6, 7, 8, 9, 10, 11. Out of 11, I have to choose. Say for example, according to my objective, according to my requirement, either I have to choose out of 11, 2. So these 2 should represent the whole characteristics of 11 students. This is sample, these 2 are the samples. Now you should know here how to choose a sample, say procedures. Then we have to collect data from these 2 samples which represents the characteristics of 11 students, that is samples. Now once we choose the samples, after that we have to approach to the sample, we have to go to the sample and collect informations. Then we have to interpret the information, we have to analyze the information. That is all about research. এক মিনিট মুচ্ছেই তো না এমন করেছি। Number 1 is research design. First one is research design. What is research design? Design of the research. Say for example, perhaps you have idea about construction of a house. Say for example, you or your fathers or your family, head of the family, interested to build or to construct a house. So what to do? Do you have any idea? Any idea? Same things, nothing but. This is research. This is research design. Design. If you want to construct a house, what to do? So what to do? You have to go to the professionals, engineers. He will chalk out a design of your house, blueprint. So research design is nothing but a blueprint. On the basis of this, you will start construction of working. Research design means nothing but this one. It's a blueprint on the basis of which you can carry out whole activity, whole research. That is called research design. There are different types of research design. Later on we will discuss one by one. Number 1 is exploratory, number 2 is experimental, number 3 is evaluative, whatever may be, okay. So there are different types of research. So what type of research? That we have to first decide. That is called research design. It is nothing but a blueprint on the basis of which everything will be going on. Okay. That is called research design. Okay. That is the first one, that is called research design. Chalo, dekhi. Next question is, again, when you construct a house, design, you have to locate the area of study. In which area or where we will conduct this study. Say for example, for the sake of your convenience, we are thinking about the simple research design here. Okay. Next is area of study. Usually for your purpose, you may select the OPD of Santiniketan Medical College and Hospitals. So area means where you will conduct the study. That is the area. A, B, C, D, whatever may be. Say for example, you can select Santiniketan Medical College Hospital OPD as an area, or you can select a village as an area. So for the sake of your convenience, we have already decided that you will select Santiniketan Medical College and Hospital as an area. স্যার ক্লাসে আমি একটু পরে বলি স্যার so you have to select an area where you will carry out the whole study, that is called area of study. Now you have to collect information. You cannot collect information from this building, no. From whom you will collect information? That means you have to select population. You have to select population of the study. That means who will be your interviewee, to whom you can interview. That means you have to select the populations. So for example, you can select all the patients or all the OPD patients who have come for their treatment at Santiniketan Medical College and Hospital. Okay. So you have to select the study population or population of study, same thing, study populations. Once you select the study populations, then again question comes about sample and sampling technique. So I told you already what is a sample. Sample means this is a sample. Suppose this is the area where the population belongs. Okay. So if you draw like this, so sample is the cross section of the populations. But one criteria you must know about the selection of samples. Whenever you select a sample, that sample must represent whole. Clear? So there are different types of samples. Okay. Right now we are not that much interested to discuss in details about all these samples. So one or two I am telling right now. Simple random sampling, systematic random sampling. Okay. These are the different types of sampling. So you have to think about the sample. That means from the area, you have chosen the populations, and from the populations, how much populations you will take for collection of data. For collection of data, this is how much populations. Here, population of study, say for example, in case it may be 200 or 500 or okay, আমি কি বোঝাতে পারলাম? Is it clear to you? Population of study, you do not know the number. You may not know because it is very difficult to know how many populations will come to attend OPD. One thing you can guess that from the previous record, say last 1 month's record or last 10 days record, how many patients are coming to attend OPD. Say for example, per day 120 or 200. So if your time of data collection is for 5 days, so you can collect 200 into 5,000 populations. So here in that case you can write or 1,000. But within 5 days it is not possible to collect information from all 1,000 populations, or if it is 1,000 instead of 1,000, it may would have been 5,000, it may have been 10,000. So it is not possible for you as a researcher to collect data or information from all 1,000 or 5,000. Then you take the sample that represents the characteristics of the whole patients. It depends. Now, choosing of sample again depends upon so many factors. Number one, the most important is prevalence of the disease. Say for example, if you select diabetes, so you have to know the prevalence rate of the diabetes mellitus among the populations who are coming to OPD of Santiniketan Medical College. Okay. According to prevalence rate, you have to select total number of sample. Then question comes about this one, selection of sample, okay, and which technique you will use while selecting the sample. I told you random sampling, I told you systematic sampling, okay. So there are different types of sampling. Usually what we do, if the patients are so many, so for example, per day 1,000 patients are coming. So your objective is per day 100 or per day 50, then 15 to 5 days 250. So which 50 you will take? You guess that last day or few days back 1,000 patients came. So your objective is to select 50. So which 50? You do not know which 50. Then 1,000 by 50. कितना होगा? कत हलो? 1,000 by 50. 20. 1,000 by 50. 20. Then you have to take the patients, first patients, 20th patients, 40th patients, 60th patients, like this. This is called systematic sampling. So you can easily opt systematic sampling. If you think it is not possible, okay, then you can select random sampling. Whoever come first, we will collect information from them without knowing anything else. So once your objective will fulfill for that day, say 20 or 30 is covered, you will come back. So then this is the fourth step. First one is research design. Second one is select the area of the study. Third one is select the populations. Among the populations, you select your sample numbers as well as sampling techniques, how you are collecting, how you are drawing samples, and what is sampling. And next, fifth one is instrumentations. With the help of which instrument you will collect information? Because if you do not opt, or if you do not frame, or if you do not prepare any instrument, then what will happen? Say for example, what is your name please? Rohit. So Rohit have collected information from one patient without taking help of any instruments. Okay, whatever he thinks important, he will ask, and he has jotted down these informations. What is your name? Sabuj. Oh, he also did not frame any instrument, did not prepare any tools to collect information. Whatever he likes or about, according to his capability, according to his knowledge, he has also collected some information from other patients. So these two informations are not same. He may forget to ask important things. He also may forget to ask important things. For the reasons, a standard instrument you have to use. In our language, we call it this instrument questionnaire. Sometimes we call it also schedule, but okay, forget about the schedule, questionnaire. So that is instrumentations 5 and 6. Administration of instrument. Okay, we have to administer this instrument. Now question comes, I told you only about the instrumentations. Administration, you have to prepare the instrument or questionnaire. You have to develop the questionnaire. That questionnaire should be relevant, concise, and it will be applicable for all. It must be pre-tested first. Okay. Pre-testing means before going to collect information with this questionnaire, you have to collect information from few respondents by using this questionnaire and see whether it will be able for the patient to answer the questions. If you are satisfied, say okay. Then you will finalize pre-testing, show your experts, then finalize the instrument. Next one is administration of instrument. Then you are using this instrument or questionnaire to collect information. And next page is methods of data collection and analysis. That is the last step. Now, questionnaire. You can distribute questionnaire to the patients. It can be, is it? Say for example, we are taking exam. What do we do? We distribute the questions to you according to your own. You are supposed to write the answer of the questions and give it to us. We will check it. Okay? Then evaluate it. That can be done. Or you can go to each and every patient, ask them on the basis of your questionnaire, and you yourself jot down the answers. As they are the human being, different components are there. So, usually to assess the human behavior, to assess the human knowledge, to assess the attitudes, to assess their skills, practice, usually we go to the interviewee or respondents and ask them in a suitable place, suitable time as will be convenient for them, create a favorable, or what I should say, congenial, or you can say supportive environment. Then you will ask them, you will interview them, you will observe them and collect data and come back with this data until unless your purpose is filled up or purpose is fulfilled. What I told you, 200. So once 200 will be covered, then you can come back. Once you collect informations, say for example, whenever you appear at the exam, what you do, but what we did, during the examinations, what do? We answer all the questions. Okay. Then the invigilators used to say half an hour more or 10 minutes more. Stop writing and give revision. Revise your answers. Likewise also, once you come back from the field, you have to revise the data, what you have collected. Maybe some errors. That's why usually we call it, with the help of the lead pencils, we will collect data. If there is any omission, if there is any error, we can erase it and we can check, we can correct it. So after collecting data, there are different steps. Checking the data, first check karo, then edit the data, edit karo thik ache kina. Then question comes about analysis. There are different steps of analysis. First one is classify the data. Say for example, you have collected information about the age of the respondents. Age may vary. If our objective is to collect informations from the adults only, then 18 years onwards you have collected data, 18 to 65, 70, whatever may be higher age. So we have to classify the data. Perhaps if you have the idea about the classifications, the statistics class it has already been discussed. Perhaps you have to classify the data. Once classification is done, then you have to tabulate the data. After tabulations, you have to analyze the data with the help of different statistical methods, several percentage, along with this chi-square tests, or correlation, regressions, mean, median, mode, then dispersions. Okay. Then interpret the data. Interpret means the results you are interpreting according to your own. Then you have to write a report. You have to, once you write a report, then you have to place the report or you will document the report in the presence of other faculties for finalizations of the report. So in a nutshell, these are the steps of clinical research or medical research, social same things that you have to do.